The recovery from knee replacement surgery is what I like to call fast and long. So the fast part's good. Currently, most of us and most in the US for otherwise healthy people are performing these surgeries primarily as an outpatient and letting people go home the same day within 3 or 4 hours, which is amazing. They use a walker or crutches maybe for a couple weeks, and most people are returned to full activity somewhere between 6 weeks and 3 months. All of that's incredibly fast compared to what it was when I first started my clinical practice 30 years ago, which is amazing. But to forget about your knee, where you feel like you don't have to think about your knee anymore, and in our world, it's called a forgotten joint. That process takes much longer. I believe it takes for most people between a year and 2 years. The good news is you can get to where you forget about your knee. The bad news is it takes a while to get there. And this is all about recovering the strength of your muscles, because what most people don't realize is that while you're developing arthritis, you're also getting weak, not only in your joint, not only in your knee, but in your body overall. And even though we eliminate the arthritis at the time of surgery, basically immediately, the muscles have to recover, and that recovery process is much longer. It's a little bit like a woman who has pregnancy after pregnancy, getting her body back after delivery. There's a process to recovering your body after being traumatized, if you will, by arthritis for such a long period of time. Most of our patients have had symptoms that have been disabling them for 2 years. So um, I always tell people it didn't happen overnight. It's not going to go away overnight. And that long part is frustrating. The important thing is that you're actually not limited in activities. It's just you still know the knee is there. We like to not have to think about your knee. That's what I consider recovered.